Hello, my name is Dr. Lindquist, and I am Chief of Geriatrics here at Northwestern Medicine in Chicago. I see so many patients in my clinic who are over the age of 80, and they're on these medication lists, and they always want a magic pill to help them age better or to help their memory stay, solid longer. We decided to take a look at the medication regimens of people who are super aging, meaning people who are over the age of 80, who have very good memories of people that are in their 40s and 50s, and compare it to people that are in my geriatrics clinic and people that are just considered normal aging. Their brains are the age of 80-year-olds and they're 80 years old themselves. And so what we did is we looked at these two medication profiles in this large cohort, and we didn't see a major difference. There was no one medicine that made your brain age better. So SuperAgers don't really differ from your average American older adult as far as types of medications. Both groups had a lot of medicines, and that kind of brings you to the thought of there's so much polypharmacy going on right now, and we should start thinking about taking off some of these medicines or taking a better look at whether or not you still need these medicines. Because many of these medicines people started when they were in their 40s and 50s, busy executives, very stressed out lifestyles, and now they're retired, they're playing pickleball, they're enjoying their life, they're going to dinner. And do they really need these medicines for their anxiety or for their stress? And that's where people should really go and see a geriatrician or talk to their primary care doctor about, do I need every medicine here? And look at the medication list. See if there's a medication that has a purpose that is still being needed. I think people need to take away from this is that there's no magic pill for you to keep your brain active, for you to live longer. What we need to do is start looking at other factors. And people are already looking at that, socialization, talking to other people, eating right, exercising. There's so much more out there than taking a pill. But I think American mentality is find a pill to treat the problem. And even among physicians, many of us say, I need a pill to treat this. What we can take away from this study is let's talk about not finding the perfect medicine, but let's talk about other things that we can do in our life, such as increasing our social skills, increasing socialization with other people, exercising, playing that pickleball, and also eating right. And so all those things are so important to aging well instead of looking for that magic pill. What the study shows is that people need to be treated as a person. So we're talking person-centered care. So medications need to be tailored to that person and what their needs are instead of just throwing on more and more medicines, which happens so much when you see specialist after specialist after specialist. So really take a look at your patients and make sure every medicine matches every purpose and think about whether or not they really need them anymore.